Now, our next patient is our periodontal patient. Now you can see from this image, the disease process has continued on. The patient has neglected their home care, and now we have bone loss. Once the patient gets to this condition, we can manage the disease, but we cannot get them back to that oral healthy state that they had prior to their bone loss. So in this image, and closer up, now we can see that this is calculus. The tissue is below that. And when we remove this deposit and we get them to healthy for their condition, we're going to have root exposure. These teeth, these lower front teeth, this one and this tooth, are probably going to be a little bit loose once we finish because they have lost bone from where my arrow is to here to probably down in this area. So not much of that root is embedded in bone. So these teeth are probably going to be very loose when we finish with this procedure. So in this treatment, we have heavy deposit that we need to remove, and then we need to work subgingivally. Now, this patient's situation, their tissue is usually bright red. It can be very tender. It can be kind of spongy. Inconsistency. The gum tissues can bleed easily when we touch them. And quite often, these patients do have an odor or a bad breath. And this condition, the odor of this is kind of associated. The best way to detect it is if you have mothballs that you use in your closet to keep the little flying bugs away from eating holes in your clothes. That is the odor that you would notice from a patient who has active periodontal disease. It smells like those mothballs that you use to keep the bugs away. So where do we start? Well, we want to remove that heavy deposit first, so then we can access down to the underneath the tissue. So we would want to, with our Smart Choice, start with the Cavitron Powerline ultrasonic inserts. And here we have choices of 4 different designs in this family, and depending on where we need to access and what we need to remove, would determine which one we would be most efficient. So first of all, we have the Cavitron Powerline 10 ultrasonic tip. And as I spoke about before, the number of zeros in our design number correlate to the number of bends. So with this patient, or excuse me, this insert design, it is a 10, and here is our single bend. So this can adapt on all surfaces of the teeth, on anything that's more of a straight surface. It is a moderate to heavy deposit removal instrument, and we can use it at all power levels. This one on that lower 4 millimeters of the active tip area is round in cross section. Now this is unique to the Powerline series. We have a 100, and it's very similar to the 10 in design, except it has 2 bends in the shank. So this is just, again, operator preference, and knowing that the different bends help with access into the posterior. So this design might be helpful in working with the premolar area, but it is round in cross section like the Powerline 10. It just has 2 bends in the shank instead of 1. It can be used on all power settings. Now we have the Powerline 1000, and this design has the same features and benefits as our Slimline 1000, but it is a thicker diameter on the active tip area. Remember, the Powerline inserts are all 30% thinner in the active tip area. Excuse me, let me start that one over. Remember that the Slimline ultrasonic tips are 30% thinner than the Power Line. So the Slimline 1000 is the same design as this Power Line 1000, but the Slimline 1000 is just 30% thinner. So this one here that we're looking at now, our Power Line 1000, is considered the workhorse. When our patients come in with that heavy deposit, this would be one of the inserts that would be a great first choice for efficiently and effectively removing that deposit. So this would be one of the two that's recommended to start with first. And again, in our cross section of the active tip area, it has that square or diamond shaped cross section, depending on which angle you're looking at, which gives us those coined edges to help efficiently remove that heavy deposit. And this tip can be used on low to higher. So just to review that, to make sure I'm clear, the Power Line 1000 is the one that would be for that really heavy super gingival initial deposit. The Slimline 1000 is the same design. It's just 30% thinner than what the Power Line is. And determining which one of the two to use is all about where the deposit is located and the access, how well that tissue can descend back, so that whichever one can fit in the area. Now the next one that would be considered an initial deposit removal insert would be our Cavitron Power Line 3 ultrasonic insert. It's also referred to as the beaver tail. And this one has a rounded toe by design. So this is the only one that we actually say to use the point, because this isn't really a point. This is a broader surface. It is an active surface. And when we adapt that toe on to the deposit, it's very effective at removing heavy calculus bridges and also heavy stain. This one can also be used on all power settings. So this would also be one that the operator, the dentist, or hygienist would want to select for very efficiently removing that heavy initial deposit. So now that we've gone over all of the designs of our different ultrasonic tips, let's go back now and look at how we would sequence those in our patient care. So first, we'll start out again with that healthy patient. And with our smart choices in our insert selection, this patient could very easily be treated with just the Thinsert ultrasonic tip. Because of its thinness, it can access underneath that tissue. The tissue is very healthy, but there's still biofilm there, and we need to disrupt the biofilm. It also can remove very light calculus deposit. So this one with access would be our smart choice. Next, our gingivitis patient. How do we combine those inserts to give that most efficient and effective clinical outcome in the treatment? We would most likely first start out with a slimline design. Again, these, because of their thinness, they can still adapt nicely around the tissues and remove a heavier deposit than what we would have with the healthy patient, although this is still a lighter calculus, but maybe a heavier biofilm. So it's very efficient at removing that. But then after we've done our initial deposit removal, they may want to then switch out and use that Thinsert to go back in for that assessment phase that we talked about, where when this insert is not activated, it's off, we can scale and explore, or we can explore with this. And then if we do find any little residual deposit, it can be activated to very efficiently remove that. So in our gingivitis patient, we would want to start with the slimline and then transition into the Thinsert. And then finally, that ever so